My name's Tom Hart and I'm Health Poverty Action's Country Director for Guatemala. Health problems in Guatemala affect people's lives to an enormous extent. Where we don't have a social security system, that means that if someone falls ill, they lose their daily income, and that in turn means that the whole family is impacted by the way that one loss of salary, one loss of income for a day, for a week, or for a month has a tremendous effect upon the whole family. The main health problems in Guatemala are around things like nutrition, where we have one of the highest chronic malnutrition rates in the world. Added to that are problems around sexual and reproductive health, for instance, maternal mortality rates. We also have a great deal of problem in affording people access to health services. Currently, Health Poverty Action in Guatemala is working on a number of different areas. One of the things that we're seriously concerned about at the moment is violence against women. This is something which has enormous health impact in people's lives. Obviously, there are physical consequences of physical and sexual abuse, but also we're talking about the social health of the community. We're talking about the cohesion of a community. In a place like Guatemala, for instance, there is tremendous impunity for violence against women. A recent study that we did in the project area in Guatemala showed that something like 80% of adult women have suffered some form of sexual, physical, verbal, psychological, or patrimonial abuse at some stage during their lives. We're also about to start, with the help of the big lottery fund, a new project on culturally appropriate maternal health services. At the moment, for instance, most of the health service in Guatemala, although it is free for the users, isn't accessible to people within indigenous communities. We're also working in Guatemala on issues such as nutrition, education, and so on, through our partners in networks. Health Poverty Action knows that we ourselves alone cannot do everything, and what we are very concerned with is to build institutional and organizational capacity within Guatemala and the rest of the countries in which we work. That means working with civil society organizations, community-based organizations, so that we're giving them the tools to work together to be able to monitor the quality of services. And this, as I say, in our case, includes nutrition, it includes education, it includes health, it includes all sorts of services where people learn how to organize, where people learn how to demand, where people learn how to hold their local office bearers and duty bearers to account, so that they begin to provide the services in the way that Guatemalan legislation obliges them to, but which up until now they have not been obliged to respond to.